Measles and rubella are two highly contagious viral diseases that spread by contact with an infected person. Both diseases cause death and disability of children worldwide. In India, more than 2.5 million children acquire the measles infection, and about 49,000 of them die each year, accounting for 37% of the disease-related deaths worldwide. Further, rubella infection leads to birth defects in almost 40,000 children in India annually. The measles, rubella or MR vaccination campaign is a part of the global effort to reduce illness and deaths due to these infections. It directly contributes to the reduction of under 5 child mortality and prevents congenital rubella syndrome. In 2014, the Government of India initiated the world's largest vaccination campaign against MR to achieve 95% vaccination coverage across the country by 2020. All children in the country from 9 months to 15 years will be administered a single shot of MR vaccine regardless of their earlier vaccination or disease status. Odisha implemented this campaign. Launched on the 29th of January 2018 by the Chief Minister of the state of achieving at least 95% of MR vaccination among all children within the next 5 weeks. The numbers were astounding. Vaccination of 1,12,25,634 children in all the 30 districts within 5 weeks. Odisha achieved its target within the given time frame only due to a clear vision and a robust plan of action.
At state level, there is one steering committee, there is one state task force. The state steering committee is being chaired by the Chief Secretary of Odisha, and the state task force is being chaired by the Secretary of Health.
There was a very well coordinated convergence at all levels in the state, starting from a Chief Secretary who gave us guidance in the steering committees, and the very highly motivated district teams headed by collectors, then also the municipal commissioners in urban local bodies. And the convergence was visible also at the GKS level.
Though the campaign was steered by Health and Family Welfare Department, Government of Odisha, different line departments played a critical role in its successful execution. UN agencies like UNICEF, UNDP, WHO and organizations like the Indian Medical Association, Indian Academy of Pediatrics and many development partners collaborated along with institutions like banks, corporate houses, police, NGOs, Coast Guard, CRPF, Army, religious leaders and media with defined roles and geographies.
The real pivotal role was the State Steering Committee chaired by our Chief Secretary, and almost we had it every month. At least 3 steering committees we had. That was the real pivot for all of us to coordinate with all the line departments. Those are linked to health department. Every day evening we sit and really we coordinate with all the districts.
The micro-level execution and successful implementation of the massive exercise within the stipulated time frame was possible only with the active involvement of grassroots functionaries of different government departments, educational institutions, development partners and communities. District, block and panchayat level officials, ANMs, ASHA, Anganwadi workers, elected representatives, teachers and community leaders were key in the successful implementation of MR vaccination drive across the state.
MR उपरे हमें फास्ट हमें माइक्रो प्लान प्रिपेयर करिछु सब माइक्रो प्लान रो डाटा हमको आशा माने सर्वे करछंती अंगनवाड़ी आशा सर्वे करछंती हमर एएनएम दीदी माने स्कूल रो जाई टीचर मानक तो आनिछंती आशा अंगनवाड़ी दीदी मानकर मेजर रोल और रेस्पोंसिबिलिटी रहउची जो सेंटर रे हमर होउची ता पूर्वरु हमको इनविटेशन कार्ड हमको दबाक पड़ुची सब लोक मान को आशा और अंगनवाड़ी मोटिवेट करके आनिचंती।
एही प्रोग्राम पय हम गाँ रे 168 जन हमर बेनिफिशियरी थिले। प्रथम आम एनएम दीदी आमको निमंत्रण पत्र देथिले। से निमंत्रण पत्र रे आमे माने से पिला मानकर नाम तांको पितांका नाम तांको बयस तांको ग्राम लेखी आशाक्रमी आउ अंगनवाड़ी दीदी मु निजे आमे 2 जन 168 जन शिशु मानक द्वारा द्वारा बुली एवं से मानक माँ मानकू बुझेइथिलु जे मिलिमिला और रुबेला टीकाकरण कोन पाई दिया जिवो एवं एई टीकाकरण देला परे शिशुर भविष्यत पई कोन उपकार रहिछि।
A 3-step strategy was adopted to vaccinate the children. The first 2 weeks focused on vaccinating children in all schools across the state. The next 2 weeks focused on reaching children in communities. Children who were not immunized in the previous rounds were also identified and vaccinated in the final week. This ensured maximum coverage of targeted children during the MR vaccination drive throughout the state. Communications was an integral part of the campaign. A comprehensive communication strategy was developed by the State Institute of Health and Family Welfare to build general awareness about the importance of the vaccination across the state. IEC materials for the campaign, like banners, posters, standees, and leaflets, were designed to spread awareness about the risk of measles and rubella and how a single shot of MR vaccination can prevent it. For enhanced focus in rural areas, interpersonal communication was given top priority to spread the message at the individual and household level. Traditional media like folk dance, street theatre, and mobile mic announcements mixed with folk entertainment were used.
MR कैंपेन रो सक्सेस पछरे हमरो जो अवेयरनेस कैंपेन थिला तार इफेक्ट जगु आमे पूरा सक्सेस पाइथिलु। ग्रासरूट लेवल ले जीकेएस इन्वॉल्वमेंट घर घर बुली आईपीसी करिबा एवं अन्य सब 360 डिग्री अप्रोच को नहीं मास मीडिया मिड मीडिया इलेक्ट्रॉनिक मीडिया समस्त को इन्वॉल्व करी आमे अचीवमेंट करिथिलु। ए सबुर सक्सेस पई आमको आमर लाइन डिपार्टमेंट रो कोऑपरेशन एवं अवेयरनेस ग्रासरूट ठारू आरंभ करी समस्त को अवेयर करिबा आमर मेन एक्टिविटी थिला।
The awareness campaign was also spread through well-defined media engagement, audiovisual and social media campaigns and regular press briefings.
ओडिशा रो प्रत्येक माँ बापा भाई भौणी मौसा माउसी समस्त को अनुरोध
मिलिमिला और रुबेला परी 2टी मारात्मक रोगरू गोटे एमआर टीका निश्चित सुरक्षा दिए।
9 मासरू 15 वर्ष जाय पिला माननकु
गोटे एमआर टीका द्वारा मिजल्स एवं रुबेला परी 2टी मारात्मक रोगरू सुरक्षा पांती।
तेणु 9 मासरू 15 वर्ष पर्यंत सबु पिलांकु एही टीका दिया जिबा अति जरूरी।
एमआर टीकाकरण करंतु।
A series of video spots and radio jingles featuring celebrities were produced and broadcast on TV, reaching out to parents and children to take MR vaccination. These videos were also uploaded on social media channels like Facebook, Twitter, and mobile platforms like WhatsApp to grab attention of the masses. Human chains and public awareness meetings were organized across the districts to spread awareness. Wide publicity during mass events like Republic Day, Tribal Fair, and the Bargad Dhanu Jatra also added value.
Communication campaigns outcome, that is achievement of more than 99% against 95% of target, clearly spells out the importance of communication and its contribution towards yielding results for any program.
Prior to the vaccination drive at the community, various organizations like Gaan Kalyan Samiti for rural areas and Mahila Arogya Samiti in urban areas were mobilized to intensify the community participation.
आम मास ग्रुप रे 13 जन मेंबर अच्छु आमे सब डोर टू डोर समस्त को घरे बुली सब माँ मान को बुझाई समस्त पिला मान को आनी 9 मासरू 15 वर्षर पिला मान को समस्त को नहीं आमर अंगनवाड़ी केन्द्र रे आशा दीदी एनुमा दीदी और अंगनवाड़ी दीदी रही आमे समस्त सब पिला मान को टीका देइछु।
आज जेमती प्रति गाँव रे जो टीम जाइछन्ती वैक्सीनेशन पई प्रति गाँव रे गाँ कल्याण समिति रो मेंबर मान थ्रो रे जति पिला अछन्ती 9 मासरू 15 वर्ष पिला समस्त को आनिकरी सहयोग करिकरी वैक्सीन करा जाउछि।
Educational institutions were an important site for MR vaccination campaign, as 70% of the targeted children are in the school-going age. Both private and government schools were brought on board to support the campaign. Special meetings, quizzes, and painting competitions were organized to mobilize students.
Myself, Sangeeta Bagdi. She is my daughter, Kanak Bagdi. Her health is my primary concern too. I have vaccinated here.
Headmasters and teachers were trained regarding the management of the vaccination process.
Mote amo Patrapuru Health Department तरफरो ट्रेनिंग पे डका जाइतला सेमाने मते ट्रेनिंग रे गोटे बही देइथिले से बही रे सब टेक्निक भाव लिखा हैतला आमे किछि दिन पर आसी पीटीए मीटिंग कलु गाँव समस्त अभिभावक उपस्थित थिले सेमानंकु एई मिलिमिला विषय रे संपूर्ण धारणा देलु ग्रामर समस्त बासिंदा एकमत होई कहिले जे आम पिला माने स्वेच्छाकृत भावे टीका नेबे.
Selected teachers and students were made MR warriors to encourage children to take the vaccination.
This is airborne disease, so we would have to take this vaccination so that we will be safe and our next two generation will be also safe.
Resistance from a few people as well as rumors created hurdles against the vaccination drive at some places. But creation of anti-rumor committees at all levels, regular interactions at community meetings, and quick response to those unfounded claims with time-to-time press briefings helped in convincing the people to immunize their children. Social Mobilization Network or SMNet team skilled at community mobilization also played a crucial role in handling resistance in certain groups. The SMNet mobilizers visited target communities for direct interaction with people at their doorstep and were able to convince and mobilize them to vaccinate their children. Efforts were made to cover all children, especially those residing in remote and hard-to-reach areas of the state. Frontline health workers braved difficult terrain, crossed dense forests and rivers to vaccinate children.
Odisha has done fairly well on the universal immunization front. However, we do have pockets, hard to reach areas also, and where our immunization is not up to the mark. But during the MR vaccination campaign, we could achieve 100% immunization even in those pockets also. These were the lessons learned, which we are now integrating in our universal immunization program.
आंकुली पंचायत आमने आसिलु गोटे डैम रे पहुँचिलु एवं डैम रे गोटे डंगा रे दीर्घ 1 घंटा पर्यंत आमने जीवु एवं गोटे जगह रे पहुँचबु से ठारू गोटे माने 45 मिनिट पहाड़ आमने चढ़ी के गोटे गाँव रे पहुँचबु से 55 माने एमआर वैक्सीनेशन करिया पाई पिलान अछंती सेठे वैक्सीनेशन सरिया परे आमने आउ गोटे दीटा माने पहाड़ चढ़ी के गाँव को जीवु से गाँव रे पुनर्बार वैक्सीनेशन करी काली आमने संध्या बेले रिटर्न करिवु.
हमरो आंकुली पंचायत रा बहुत घाटी पहाड़ जुगु बोली दीदी माने अपाहार कष्ट करी के जो टीकाकरण देबा पई बोली जाउछन.
The last 7 days of the MR vaccination drive focused on identifying the unimmunized children and bringing them either to the schools or to the community centers for vaccination. This additional push helped in achieving the last mile coverage. Every vaccination point was supplied with an AEFI kit containing basic medicines to handle any emergency or AEFI situation. Mock drills on AEFI management were conducted by medical officers and vaccinators were geared up for any unseen eventuality. Monitoring and reporting process of such incidents, including case management, was given utmost priority at all levels. Odisha achieved success in MR drive by vaccinating more than 98.3% of targeted children as against the expected national figure of 95%. Districts like Khorda, Sonpur and Mayurbhanj created history with 100% immunization achieved during the campaign period. Even in districts like Gajapati, which initially faced some resistance, the administration overcame the challenges with a series of dialogues with the communities and ultimately achieved a record 99.2% vaccination. Since the vaccination campaign was for only 5 weeks, ensuring adequate vaccines at the state vaccine store, timely replenishment of vaccines at various cold chain points, and ensuring distribution down to the community level as per indent was a daunting task. The supply lines of vaccines were well organized to meet the demand schedules. This vaccine stock management was handled on mobile phones through an online app called Even.
Even is a technological tool. It's an innovative tool of the Universal Immunization Program, by which we can track each and every dose of vaccine as well as the temperature of the cold chain equipments. So here in MR we have tracked around 1,22 lakhs of doses in each and every day of the activity. Due to efficient management of the vaccine tracking, the vaccine wastage also has been reduced to 5.9, which is, I think, very lowest in the campaign activity.
Prime challenge was because we received huge quantity of syringes and vaccine. Our priority was to ensure that the vaccine reaches all cold chain point. Accordingly, we planned, and all the field level staff, starting from ANM to Lady Health Visitor to DVLM and District Authority, Health Authority, they all cooperated, and the campaign was very success because of involvement of them and timely management of vaccine supply, and also the maintenance of cold chain for quality vaccine supply in the district.
A record number of more than 1 crore children were immunized with MR vaccination within a span of only 19 days. This can be attributed to the proper coordination, effective monitoring, and overall guidance of the Health and Family Welfare Department of the state government, along with active participation and dedication of the district, block, and panchayat level officials and the frontline workers.
I must congratulate Odisha state for running a very successful MR campaign, which was a demonstration of their very high level of administrative and political commitment for not just helping the children in Odisha survive but also thrive.
During the campaign, WHO monitored the immunization sessions, conducted rapid convenience immunization monitoring, and kept giving regular feedback to the various authorities and administrators so that appropriate corrective actions could be taken. Through a highly effective partnership between the government and partners, the campaign coverage exceeded 98%.
The leadership of the MR vaccination campaign by the top administrators of the government, interdepartmental convergence, involvement of development partners, and day-to-day monitoring and supervision were the key factors for its record success in Odisha.
I would like to acknowledge and appreciate the efforts of all those who gave in their best to make the MR vaccination hugely successful in the state, starting from MD NHM, the directorates, and our development partners like WHO, UNDP, UNICEF, and the other partners including the Rotary Club, the Lions Club, the IMA, the IAP, and all those frontline health workers, highly motivated of them, and last but not the least, the parents who brought their children to the sessions as per our fixed schedules.
With the success of MR vaccination campaign, Odisha has taken firm steps to protect the future generations, making it a healthier state.